from Prevention Institute to talk about some work we are jointly launching on operationalizing racism as a public health crisis. And then the second half of the call or so, we'll just have open discussion. I'm flagging in advance that my Wi-Fi is funky today because my kid is quarantined with the rest of her class due to a possible COVID exposure. So hopefully you don't lose me. Let me know if something doesn't work with the slides, and then Gabby can always take over moving them. So let me briefly highlight that from Prevention Institute, we have Rachel Davis. Hi, Rachel.
Hi, everyone.
Say hi.
Good to be with you.
I'm scrolling through here. We have Laquana Williams. I can't see everybody. And then I think Sandra's on, right? Yeah. And you'll hear from, in particular, Laquana about this work, but I just wanted to start, oops, this moves really quickly, with a little bit of background, you know, among us about things that we talked about within the coalition. Also, before we even get into the racism work that we're undertaking, I think many of you know that we've done a number of projects with Prevention Institute over the years. Our community safety pathways, that's not the title, but our violence prevention that we report that we released a few months ago is with Prevention Institute. We are also working with them on another project around lessons learned from COVID and equity, which you all will hear more about at the member meeting. Gabby's been taking the lead on our team on that, and we'll be talking about that at the meeting. So really just want to appreciate the sort of long-term and ongoing partnerships that we have with PI in these on these things that really overlap in the things that their organization and our organization cares about. So, you know, I think many of you know we internally have been talking about all of the declarations of racism as a public health crisis in your jurisdictions and others, and what that means, and how do we start to move the needle, and what do we do next besides just saying it, not to say that, you know, nothing, but what's next. So that was also echoed in the interviews and the surveys that we did with you and your senior teams, with Drexel, and, you know, 2/3 of you, and I think you guys have seen these before, but we want to share this again. 2/3 of the senior staff in the health department said that addressing racism as a public health crisis was a very important priority. You know, we heard that one of the collective activities BCHC should focus on is a common response to racism and health inequity. Also, the work with our national partners suggested that you know, this sort of work was a missing activity from BCHC, and we were really in a position to work on straightforward messaging about equity and structural racism. The other thing I would add that isn't on this slide is we asked about barriers to doing this work, and what we heard from you and your teams was we don't have dedicated time and resources, but even where there is time and resources, what's the first step, and how do you really start that movement? So we've been chatting with Prevention Institute about some of this, gosh, for at least 6 months, and really thinking about where to go and what we could do. And so this is where we landed. And like I said, Laquana is going to walk you through sort of what we've proposed RWJ and got some seed funding for, and where we see this heading, and then really want feedback from you all around our next step. So with that, I'm going to go to the next slide, and I'll turn it over to you, Laquana.
Perfect. Thank you, Chrissy. Thank you all so much for having us today. We, and myself in particular, will be sharing a little bit about the project that we've conceptualized and have received funding for so far. And we're really excited about it. And I hope that this can be an interactive process. So please feel free to ask questions in the chat. We'll have some time for Q&A near the end. And then we have some discussion questions that are going to be open-ended as well too. So feel free to unmute yourself and answer that way or type into the chat as well. So what is the project? We are talking about this work as Advancing Racial Justice for Health. And what it is an initiative designed to re-envision and strengthen the infrastructure and capacities necessary to shift from making declarations about public health, racism as a public health crisis, actually working more intentionally with communities to transform our systems, policies, practices, and power dynamics. So to really be responsive of the needs of the funding, both PI and BCHC, for a 12-month planning phase. That planning phase began last month, and it will go through 8/14 of 2022. We're also in conversations or discussions with Kellogg and Kresge, so we're not totally sure how this will all shape up related to funding just yet, but we know that additional resources for this work will be coming as well. So what's it look like overall? As I mentioned, first we're entering into a planning phase. And then from there, we'll move into our implementation phase following that 1 year of planning. So the objective for the work is to gather and leverage some existing knowledge of both successes and challenges from communities like the ones you all work in, from public agencies who are currently taking action to dismantle structural racism and advance racial justice. So for already working in this area, we want to know what's working well, what's challenging, and then what we will deliver is what we're calling a playbook that details some policies, practices, systems change, and community engagement, and of course, collaborative governance activities to help inform the field of how to continue moving this work forward. So the current plan, I don't believe any of this piece is like fully set in stone just yet, but we are looking to work with about 3 to 5 BCHC jurisdictions to start with, and to include a fundraising strategy for this work. The implementation phase itself, we have a couple of ideas for it. We're looking at opportunities for a community of practice. Of course, the direct support of some of those BCHC implementation sites. And that process will last over 3 to 5 years. So the objectives and deliverables, how are we going to accomplish it? So these are some of the activities that we have planned for this particular project. One of the first steps is that we want to actually convene an advisory committee. And that advisory committee, we're hoping will comprise of leaders, as well as other government agency leaders within local jurisdictions, of course, CBOs and national nonprofits. We want to make sure that there's a good mixture of both folks who work in the public health realm specifically, and also folks who work specifically on racial justice. And so for those of you who are at the nexus of that, that's even better, right? Because you are speaking to both sides of that coin. So we will be in the process of doing things like developing a criteria for how we select folks. And I think part of the goal for that is to share out and reflect on some of the emerging best practices for what comes out of the advisory committee, and obviously even recommending one, or what the makeup of one actually looks like. We'll also be reviewing some of the actions taken after declarations of racism as a public health crisis have been made. So some of them, as you know, Chrissy mentioned, in some ways, a lot of this work has felt really symbolic, and that's a step, right? So we're also going to be looking at understanding what folks are doing who are moving a little bit further beyond that, like what it's taking locally on the ground in order to make that happen. So we'll be studying some of that. We will conduct a scan to gather emerging policy and practice-based racial justice recommendations that can be shared with the field. We're also going to conduct a preliminary narrative and framing analysis about racism as a public health crisis in general. And then we will be conducting some subject matter expert interviews on the current state of implementation of racial justice strategies and interventions. So this information will hopefully help to inform the field about how to continue moving this work upstream. So I'm going to pause there and see if there are any, actually, first I'm going to pause and see if there's anything that my colleagues on the line would like to add to what I've shared so far, and then open it up to any questions or comments from you all. So Rachel, Sandra, Chrissy, Gabby, anything you'd like to add?
I thought that was great. I don't have anything to add. Thanks, Laquana.
Thank you. Anyone else? No? Okay. From the broader audience, anything I can clarify before we move into some discussion questions? Let me scroll really quickly. Okay, seeing none. I'll keep. If I'm missing anything, Gabby, let me know. All right, names that we've developed for all of you, and maybe a little bit small, so often, like I said, please feel free to unmute yourselves and definitely add to the conversation via chat. So the first question that we have here for you all is, as you work to advance health equity and racial justice in your own jurisdiction, what type of information would be helpful to glean from the broader collaborative? So in other words, or maybe a second part of that question is, what are you also hoping to take back to your community? So what do you hope to learn? What are you hoping to take back? How could this work be beneficial for you all as a collaborative?
I'll jump in. This is Gretchen from Minneapolis. So our resolution has some specific action steps. It's kind of fallen to me to make sure people are doing anything on those action steps. There was no resource set aside, so I think one thing I would like to learn is what kind of resourcing have successful places done of their resolutions, so that I might take it back and say, this is, this is a best practice, or this is something that's working in other places. Also, I think our action items were crafted from a point in time, and I would imagine that we might want to add to them or change them. And so learning about what kinds of action steps or direction, giving has come through these resolutions or these statements would also help us continue to refresh and modify ours.
Perfect. Thank you so much, Gretchen. I think I got down what you shared there, so I appreciate you for sharing, and I think others are probably in alignment with your questions as well. I see a virtual hand here. I'm going to go with Dr. Wooten first, and then Allison, I'll come to you.
Thank you, Laquana. In the chat, I think what we could learn from these collaboratives or a collaborative focused on this is to glean best practices from other jurisdictions regarding activities and how we can operationalize advancing racial justice. What type of metrics should we all be looking at so that we can show a collective advance or improvement in this issue? Yeah, it's always good to hear what other people are doing, whether it's to learn something new or to validate what you are already doing. But the metrics for me is very important, because if we want to show that we're moving the needle collectively, we all have to be doing some things similarly.
Right. Absolutely. Thank you, Dr. Wooten.
You're welcome.
Allison?
I would just add, divide our work up here into the work that we do externally and then the work that we do internally. And so externally, I'm always interested sort of very high level, just in where the health department is weighing in on this. So, you know, I was talking to New York the other day and they're doing some really interesting stuff about trying to think about how to get racism out of like clinical algorithms with their FQHCs, like just something I had never really considered. And so I feel like externally, high level for the things people are doing is often to kind of get us thinking and going. But then internally, where I think about what are we doing as public health departments or as cities to actually advance health equity and racial justice as our own organizations, I'm often very interested in the details there, as in like, what specifically are people doing around hiring, RFPs and contracts, and funding small BIPOC organizations, you know, some of this kind of work. And, you know, I think often we share, like there are things that are different in public spaces, where whether it's working with unions and trying to hire people who are bilingual and how you get around some of that. Like, and so sometimes it's as basic as like sharing policies, sharing written things that have successfully gotten through. But I think I agree with what others have said, but this kind of how to operationalize stuff, especially interested for us internally, how people have gotten serious about this on the internal side, and then just best practices for making this be something that people take up across all parts of your department.
Absolutely. Thank you so much, Allison, for sharing. Go with, I see a virtual hand from Kimmy Watkins Tart, and then we'll go to Jessica after that.
Hi, good morning. So this may have been covered in the first part of your presentation. I apologize, I joined a little late, but two questions I have about this is there an opportunity to get more information about how jurisdictions are connecting this work with existing or newly emerging work around reparations? So some jurisdictions have done both. They've made the declaration around racism as a public health issue, and their jurisdictions have also made statements around reparations. And how are they connecting these two things? Would be helpful to know more about that. And then the second question I have is, or ask, is examples of really strong partnerships between public health departments and community-based organizations in advancing racial justice work.
Mm-hmm. Thank you. Two super important pieces. Definitely be looking into that. Thank you. Jessica.
Hi, everyone. Good morning. Let me make sure I take my hand down. This has been a bane of my existence this week. I would say for us in Multnomah County, what would be really helpful is just emphasizing the continued connection between high impact policies and the relationship to racism as a public health crisis. Because what I feel like has happened here is that, to Allison's point, we have like a really robust internal process around workforce development and our equity internally, but somehow there seems to be a little bit of a disconnect between issues that we've been trying to work on for a long time, like for example, tobacco flavors, like something like that. There seems to be a little bit of a disconnect sometimes around managing a policy like that forward at the local level and the declaration. Like that is addressing racism as a public health crisis. So making it very concrete that there is definitely new work to be done, but there's also some work, at least in my jurisdiction, that we have to shore up that's been on the menu forever. And we've got to like shore that up as a very meaningful action item. And it helps to have other jurisdictions of like size and organizations like big cities and the Prevention Institute to sort of concretize that as like a step forward in that trajectory. So I don't know why, I don't know if it's just Multnomah County if other people experience this, but it seems like there's some disassociation sometimes between like making a proclamation around racism as a public health crisis and a like really hard lift on a policy. Does that make sense?
I think that does make a lot of sense. And I also think, you know, that's why it's so important for us to see what's currently out there, and then to even, you know, also develop some criteria for like, is this addressing racial justice, and are there some heavier lifts that could be happening here? So how to categorize those, I think, is important. Thank you for sharing, Jessica. There's some activity going on in the chat. Folks says there's lots of resources at GARE. There absolutely are great resources from GARE.
I raised my hand again, Laquana. So I echo what Allison stated. That's exactly the way I frame it here in San Diego in terms of what our Office of Health Equity does, primarily focusing internally on workforce development, training, that whole thing, but also looking at health equity, looking at all of the services we provide through a health equity lens, and then focusing externally. And we try to have incorporated that into our strategic plan as it relates to health equity. What is one objective that each grant can focus, at each branch, we call our subdivisions of our department branches, and focus on. And so we have begun we identified those, again, management by our Office of Health Equity, writing white papers, putting it in our strategic plan, and developing metrics to follow the progress of those specific issues, like in maternal, child, and family health services. We've identified infant mortality. You know, it's probably, you know, no big surprise there. So the internal and the external, I think, is a great way to explain how we operationalize the work. But I think more can be done in identifying the operationalization of countywide for health equity and racial justice. Because those are just the public health things. It really should go beyond public health and go across all of the departments in a particular jurisdiction.
Mm-hmm. Exactly. Thank you.
Mm-hmm.
Thank you for adding that. Okay, lots coming up there. I want to keep moving because we have some more questions for you all. So not sure if you want to throw it back, Chris, I can read the next question. And we've kind of gotten into some of this already, but the next one is, what considerations or opportunities and challenges are you coming across in your work to advance health equity and racial justice? So what's currently coming up for you that you're finding as an opportunity or as a challenge, particularly in your work within your jurisdiction, that you'd like to maybe lift up? Because I think what we learn here is that those things happen in silos, and typically other folks are struggling with them as well.
And I put that question in the chat.
Thank you.
Well, this is Wilma again, and just very briefly, it's kind of the obvious with light of the COVID-19 pandemic is taking staff away from focusing on those issues, or externally as well as internally, just into the COVID-19. And COVID-19 pandemic could be anything. It could be some other type of outbreak or some other type of issue, like in San Diego, being on the border, we have refugees, and also we are one of the locations cited for resettlement of the Afghans. So when those types of things rear their heads, you have to divert staff resources to focus on those because they become priority. So for me, that's a constant challenge.
Yes. Thank you for sharing. I see a Gretchen.
Yeah, thanks. And maybe this picks up on a comment that was started by Allison. we are just running into a lot of barriers with our city systems around procurement and distribution of funds. So as we try and recognize the valuable time of community members and on stipends or gift cards for time, there's just like all kinds of stopgap. If we want to have different kinds of contracts or contracts with different speed, even smaller contracts with the organizations, oftentimes we're getting, again, running into rules that were set up about contracting process for big projects. And so, and we have our meetings and we make our case, people listen, and then they tell us these 99 ways we can do workarounds. So just would be interested in others who are struggling with that or have struggled with it, or if there are some best practices we can say, we can tell our folks, you know, you're out of touch, you're 2 decades behind, this is how it's done somewhere else. That would be fantastic. We're spending a lot of time.
Perfect. Thank you for sharing, Gretchen. Kimmy.
To pick up on what Wilma mentioned, but on the flip side, that COVID has provided actually an opportunity to really have everyone looking at all the different factors that are affecting this health issue in a way that we often don't have, you know, that kind of opportunity. And so it has actually helped us to articulate and re-articulate the connections between things and the importance of every decision we're making, and on how it impacts a health issue that everyone's looking at right now, whether it's procurement, whether it's, you know, little tiny things. And so that's actually a positive thing. But I'll definitely wonder how we harness that and bring that forward in other areas. The other thing, though, that I wanted to point out is to ask others about is, as a health department that sits in a county, sometimes it's a little challenging, I find, to get traction in some of the areas that really are important areas to address in the arena of health equity, because they sit with cities. You know, the responsibility. So for cities where the health department is with the city, I think their situation is different. And so it would be helpful to get more insight and more information from health departments that are sitting inside of a county structure, and how you get that cross-jurisdictional work happening, given that you have cities inside of your borders that are in charge of your economic development, your housing, your, you know, those kinds of things.
Thank you so much, Kimmy. Kelly, and then I'll go to Allison.
Yes, good afternoon there, but good morning to all people. The key pieces for us in the last 2 years. So we were able to move, so many years ago, the city opened the Office of Equity in the health department because we found funding to start that process. And then we were able to move into the EOC. We took the equity office and their team into the Emergency Operations Center to train and guide and lead the ability to respond around COVID from an equity lens. And in that process, soon after that, we had the murder of George Floyd, and our city went through a reconciliation process. And so that reconciliation process includes all departments and all key goals. And you were to get your own house in order and be able to engage with community. So those months last year drove and escalated, elevated process that I don't know that we could have ever gotten to otherwise. And then within that piece, because of COVID and because of the impacts and the underlying health conditions that we've been facing, the differences in vaccine, the whole city now sort of talks equity. So the CARES Act funding, the Recovery Act funding, all the funds going out the door are being viewed through an equity lens based on those data. So we really had, it really has created a conversation where people understand what we're talking about. We're breaking down the data and understanding what's behind it. Some of it feels like a little like lip service. Some of it is really happening. I think it's a mix, depending on who you're talking to. But in all that, they moved the equity office from the health department to the city manager's office to bring it a more large, a broader conversation, so that when we're talking about all of the work, that is a lens, and then each department is being required to build their equity plans and attend trainings and do all that. So I think that it's our challenges are, it's hard work. Everybody looks at equity as if it's a pie for which there's no more resources. So if you take from here, you're going to pull from one community to give to another, and they don't see it as this broader conversation, particularly at a political level. So we're living that, like the health equity, people talk about it, right? Equity overall, yes, we're having these conversations. We're able to talk about race at council meetings and things we were never able to do before. But there is a lot of concern about what does it mean for resourcing and how do we design differently, and that's the piece that we're having a hard time with is, yes, we can talk about it. Yes, we stand for it, but not until you take money and we start to invest differently. And so I think that's our challenge, is to continue to help people understand that it really, when you invest in certain cities that have not been doing well, and you invest in populations where your outcomes are just so much below where they are for others, then you actually are you're lifting the whole city. And that message doesn't have a lot of traction. And so that's the area that I think for us is like, how do we start to build that understanding, that buy-in, and that move from an infrastructure that we've now established that's allowed us to move this work forward.
Awesome. Thank you, Kelly. Allison?
Just a very quick follow-up, sort of off what Gretchen was saying a little bit. So I think where we have run into, where I think about sort of how COVID has run up against sort of city processes, we are also similar to what Kelly is saying. I mean, it's been a focus for a long time, more so here. It's funny because now we've got like, everybody is like, you have to do the same racial equity rapid response team that you did for COVID. You have to do that for like everything in all of Chicago. But the administrative piece of this, actually, what we've been really calling it administrative preparedness, administrative equity, is in a lot of ways the biggest challenge to doing this. Because I think what people understood for COVID, at least here in Chicago, we're quite a racially segregated city. And so you cannot, I mean, there's a lot of EEO, there's a lot of things around how you use race when you hire, or you contract even, and how do you define what is a BIPOC organization? We are able to, and I imagine many of you are able to, there's a little bit of a proxy that when we say your organization must be based in X neighborhood, for example, or this zip code, and it is a high need zip code, that is a way of sort of addressing equity issues. But it means very often funding small organizations. And this issue, this difference between being able to fund, $5,000 or $10,000 for your walkability assessment or your community health outreach or whatever it is the exact same system as we use to like rebuild O'Hare Airport, right? And so we've been doing a ton of work here, thinking about lead agents, thinking about a completely different contracting process for, say, sub $50,000 grants. Cities never had it. And we are also very much trying to get our public health like foundation fund thing that we've been trying to get going for years. I think we're actually going to get it done largely to be able to meet this, because people have seen in COVID that you got to fund folks on the ground, right? All over this country, there's a strong recognition, especially on vaccine outreach. Like, you want to get this done, it means funding the small organizations who are of community, which of course is something we've always wanted to do. And I think there needs to be a real push for how we actually administratively have a different way defining what it means to these, and then having some that don't require these organizations to float their own paychecks for 9 months before you can be able to them, and don't require them to carry 9 lawyers worth of indemnification things and all of the rest of it that's more appropriate for building an airport or a highway. So I do think it's this very specific piece, but it's been most practical we both have run up against, but I think have been able to make some progress. And I think we're going to get our foundation done partly to address.
Thank you so much, Allison. I just want to add that there's not, this is not the only opportunity for you all to weigh in on this. So we will be coming back to you all to gather more information. So I'm sorry. Okay, yeah, so we will be doing that. We have one more question, and it's a poll question. So I'm going to ask Chrissy to go ahead and launch it. And the question is about if and how you are interested in being more directly involved in this work initiative. And you should be able to select more than one. So we talked about an advisory committee. So would you be interested in recommending folks to participate in that? Would you be interested in recommending subject matter expert interviews on the current state of racial justice strategies and interventions, identifying jurisdictions you are most interested in learning from, providing data, source material, other feedback, and or reviewing and offering feedback on the playbook which we'll be developing as part of our objectives. So please feel free to select one or more of those if you're interested. And I think we will also be doing some additional follow-up, connecting with you all individually, for those of you who express interest in this work going forward. And Chrissy, whenever you feel like we've got the bulk of answers, you can go ahead and close the poll and launch the results.
I'm going to leave it open another minute because we're still waiting on some folks. And I would so thanks, Laquana, for walking everybody through that and for facilitating the feedback discussion. I would just add again that, this is not your only chance to weigh in on this work. We will 100% keep you all posted as we start making progress towards each of these pieces. And, we really do want to make sure that it is actionable and useful on the ground. So we will, continue to reach out. If there are specific, if you have additional specific comments, questions, you can reach out to me or Gabby, and we'll loop in the whole PI team. We are having, I think we have monthly meetings to talk through where we're going next with this work. So I guess I'll go ahead and end the poll. Can everybody see the results, or do I have to hit share results? Yeah, I probably could do that. Everybody wants to participate in everything. That's good. All right. Well, again, we will follow up with everybody on some of these things, and do let us know how you want to be engaged.